It's 3 o'clock, and our next committee of the day is the Budget and Finance Committee. Those committee members are Freeman, Amobian, Malik, Baylor, and Lombardo. Whenever you're ready, Mr. Chair.
Okay, thank you. I'd like to call the Budget and Finance Committee meeting to order. Do I have a motion to accept the minutes from the last meeting?
Motion to accept.
So moved.
Okay, we have a motion and a second. All in favor, let it be known by saying aye.
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 Okay, very good. We are going to go a bit out of order here, and we're going to go to our new business first, if we could do that. So we will come back to old business. So we'll read in the one ordinance, new ordinance that came in today, and this is an ordinance authorizing the purchasing agent or her designee to execute a contract or contract with Tyler Technologies to extend the Akron Municipal Court's implementation services of the Odyssey Case Management System software as a service to purchase a CMS integration toolkit and declaring an emergency. Mr. Fricker?
So I'm going to defer to Ms. Jackson from the courts to speak on this issue.
Very good.
Good afternoon, everyone. We also have the Clerk Walsh, and sorry, I'm on Zoom. I'm out of state today, but we have Ramona Benson and Clerk Walsh present.
Thank you.
We'll ask you nice and close on the mic. I know listening to the meetings online at 1 o'clock today, if somebody wasn't really close, I wasn't getting it, so okay. Thank you. Pull it back toward you.
Okay.
Okay, thank you.
All right. Actually, what we would like to explain is there are two parts to this. It would be an extension of the contract because things are just moving a little bit slower than just a natural progression. So we would like to extend the contract so that when we do go operational, everything is functional, we're completely up to date and ready to start. So it's between COVID and everything else, we've gone a little bit, we're just behind on getting as much integrated as we need to get integrated. So the contract extension is adding another $46,200 to it. It's a total of $91,200, but we were able to save $45,000 in travel because people weren't traveling in to assist us. That's another reason for some of the delay. We haven't had as much on-site interaction as we could have due to COVID. So we're saving it on the travel and eating that up, but it'll be another $46,000 in terms of the length of the contract. And we need $51,000 for an integration toolkit, which is probably something we should have done right from the very beginning. I'm going to plead guilty. I wasn't here then. But we need the toolkit in order to make it work with systems with the state, the BMV, other e-citations, so that the Tyler software works with other computer softwares, and that's the gist of the integration toolkit. So we need that. And there had been a third part, which is going to be separated off. That was $40,000 for the electronic monitoring.
Say that again for the...
$40,000 for electronic monitoring in the supervision division, but it was not part of the original contract, so it's going to be separated off into another.
Okay, very good.
Is that correct, Montrella?
Yeah, that's at this point, it's not part of the Tyler request that we have, but I do also want to share that the extension amount and the toolkit amount are being funded from the court's computerization fund. Both the clerk has a computerization fund and the judges, and it's exclusively for the purpose of computerization of the court.
Thank you. And then we have the privilege of having the individual that is going to be administering. Please introduce yourself to us.
Hello, my name is Ramona Benson. I am the project manager that was hired by Akron Municipal Court to implement Tyler Odyssey. So I've just been with the court a little over a year now. When I came in, the contract was already signed, and we jumped headfirst into the implementation. But as the clerk mentioned, due to the pandemic and kind of working off-site, and the vendor is actually stationed, headquartered in Texas, and they were originally supposed to be flying in every week and working with us on site. But because of the pandemic, we've been working remotely, which has presented some challenges in and of itself. So outside of the pandemic, just in terms of the computer system itself, the one we currently have is over 30 years old, maybe closer to 36 years old. So this is a huge undertaking. There's a lot of working parts. Just the court in and of itself, we've never had to do this. So going from one system that's really antiquated to this newer, much more high-profile platform, there were some things that we probably should have addressed early on, which is the integration toolkit that the clerk mentioned. What that's going to do is it's going to allow us to take data from our system and massage it so that it can easily go into other systems. For instance, like she mentioned, the BMV, the House Supreme Court, when we have to report our caseloads and things of that nature, and also even information coming in when we have to schedule tickets. So those processes will be automated so that we don't have to incur additional costs by adding staff to enter court dates on tickets. We can do that automatic. But the big benefit of the integration toolkit is that by purchasing it, we own that, and we own the data in it, and so we don't have to rely on the vendor to do any type of future modifications to the system when we're talking about our data. Otherwise, every time we needed to manipulate any data, we'd have to go back to the vendor. By doing this, we'll train staff in-house to be able to manage our data.
Okay. And how long have you been with the city?
Just a little over a year. It was December of 2020 I started.
And we stole you from where?
Cleveland.
Okay, that's right.
I was with Cleveland Municipal Court for about 23, 24 years, pretty much in the same role. I had several roles while there, including being the Chief Information Officer as well as the Senior Project Manager. And I implemented several computer systems while there, 5 over my tenure there. So this is a change coming to Akron. Actually, I'm born and raised in Akron, so it's good to be home. So I'm just happy to be here.
Yeah, welcome home. We look forward to seeing the project move forward.
Thank you.
Ms. Jackson, do you have anything that you wanted to add, or? Montrella, anything that you wanted to add?
Oh, I'm sorry, I didn't hear you. No, they have covered everything. Excellent.
Okay, very, very good. What kind of time frame are you looking at on this? Is it?
So by extending this contract, it's really just another 6 months. We were supposed to go live in January, so now our target date is the first week in June.
Okay.
But the sooner we can get the integration toolkit, the sooner we can.
You guys need this passed,
Oh,
like tonight?
Today, 5 minutes ago. No, because
Can it wait a week, or?
if we have to wait a week, that's fine. I can let the vendor know, but we do kind of need it passed as soon as possible because, again, we have to relay the information to them, and then they have to schedule their resources. Okay. So the longer
based on
we wait,
that, could we ask for suspension of the rules?
Yeah.
Okay. I've not entertained any questions yet, but when you have any questions or comments, I see Ms. Amobian, please.
Thank you, Mr. Chair, and thank you, Ms. Benson and Ms. Walsh, for an excellent presentation, and certainly Montrella. Let me ask you this. One of the concerns that we have, and we have been talking about this for some time, is the evictions that we have in the city of Akron. I think you probably know that we have the highest eviction rate in the state of Ohio. Is there a way that we can pull this kind of information out of the software system that you're talking about today Could we get that kind of information quickly, or will it take some time?
Are you asking, like, in terms of report data, like reports on numbers of evictions and eviction rates? Is that what you're asking?
All the information you can tell us about the eviction problem that we have in terms of cases that are pending before the court, cases hopefully that have been resolved. We did hear last week about the ODR process system that's been raved about by the Supreme Court, but that talks to me about a process that's in place to handle these cases. I'm curious as to how many we have, how many are pending before the court, that kind of information. Is there a way that we can pull that information out of the system today?
Sure, I can answer that. So yes, we have that information available now. What the new case management system will do is make the information more readily available at our fingertips, where any staff member can pull that report. Right now, we have an IT person that runs those reports, but yes, that's information available to the public currently.
So can I get it? Who do I have to request it from?
I consider you've requested it, so yeah, we'll make sure. I know between Debbie and I, we will make sure that information gets to you.
Thank you so very much.
Yes.
Thank you. Any other comments or questions?
So welcome aboard, Ramona.
Thank you, Ms. Amobian.
All right. Yes, Mr. Fusco.
Thank you.
I didn't hear there was a question that Steve, I didn't hear what that question was. Did Steve have a question?
I'm sorry, I didn't see a hand up here. Did I miss something? Okay, I'm going to go to Mr. Fusco, who had a question.
Just like to, the data that you provide for Ms. Amobian, could you please provide that for all council? Thank you.
Yes.
Excellent. All right, any other questions or comments? And did someone make a motion to suspend the rules? Well,
So move.
Second.
okay, we have a motion and a second. All in favor of suspension of the rules, please let it be known by saying aye.
Aye.
Opposed? All right, we will pass that this evening. Thank you very much. Good luck to you on your project.
Thank you very much.
Thank you, everyone.
for your consideration.
Thank you so much.
All right, now my computer keeps going to sleep.
Mr. Chair.
Yes, ma'am.
I'm sure the clerk told you about Commissioner Skoda.
Yes, ma'am.
Did you get that information?
Yes, I did. Thank you.
Oh, I'm sorry. Okay, I just want to make sure. Thank you.
All right. Now we will move back into old legislation. And there was, thanks to everybody that participated in the operating budget hearings last week, and we did have a few questions from members of council. We wanted to take time to entertain those questions, and so at this time, I would kind of open up the floor to both committee members as well as any other council members. I would probably defer to committee members first. So questions, comments? All right, I see Ms. Amobian's hand. Ms. Amobian.
Yes, thank you, Mr. Chair. I have been reviewing this budget all weekend long, trying to get my arms around it. I know that we are expecting to get $145 million, totally unexpected from the federal government. And according to the information we received, I think it's $65 million that's included in this particular budget. I can tell you that I feel very troubled by the fact that we don't have more information about the rollout of the rehab housing and the eviction problem that we have in this city. I did speak with Mr. Lash today, and I spoke to Mr. Bowman, and Mr. Bowman told me last week, and this is not a totally accurate quote, but he did mention that we could have up to 700 houses rehabbed over the years of this funding being available. My problem that I have is that we need to roll out something sooner than whenever the plan is. I see it on the books as $3 million in this budget. I don't know if that's enough. I'm troubled that we don't have a plan. I was hoping that we could get something out this spring, summer, and start rehabbing houses. I do see all these, pet projects of new development and all of that. I'm just troubled that we don't have a better plan to roll out the rehab project, and I find that troubling. And again, we've talked, I know I went to several of these board meetings where we met with the public and talked to them about, asked them for their feedback. And the plan that Guy House and Shelley at the time indicated to the public that we were going to come back to them and talk to them about how this money was going to be rolled out. So I don't know if Guide House is with us today or if they plan to come back to us and talk specifically about their role. They were actively involved in listening and getting info, and I was under the impression that they were going to continue to be involved to help us share with the public about the rollout. So those are my concerns, and again, I did make calls to people to get more information, but I'm deeply troubled by what I'm hearing, and I wish that we could do something to speed this rollout of the rehab and the addressing the eviction problem a little quicker. With that, I'll turn it over to Mr. Fricker or whomever. Thank you.
Okay, so I could speak a little bit to, so as Ms. Omobian said, we are working to get our housing rehab program established. We are still working through some of the details on that. As soon as we have more information about, when we have more specifics about how the application process is going to work and how the the contractors are going to be hired, and we're going to hire some staff as well, we will certainly pass those along to council. But we are, there's a lot going on right now. We are trying to get that program established.
Thank you, Mr. Fricker. Looking for any other comments, questions? Oh, thank you. I'm sorry, I didn't see you there, Ms. Holland. Please.
Thank you, Mr. Chair, and thank you, Mr. Fricker, and all who put so much work into creating this proposed budget. I'd like to tag on to Councilwoman Amobian's remarks and maybe drive it home a little bit, and I don't expect a response or a promise, but I think that so much of what I've heard in my comparatively limited time on City Council has had to do with housing. I am on one hand pleased to see that our concerns have been heard in so much as we see an increase in staffing of housing inspection capacity. That's a really good thing. I'm hopeful that as we move forward, we'll see perhaps some more meaningful enforcement of our housing codes, some greater enforcement there. And I want to raise both hands on the issue of making programs available to people who are in homes, who are hanging on by their fingernails. This is the plight of so many Akron residents, and even as we all note somberly with concern that the projected income tax revenue is at a significant rate of decline, I think we really all should link arms in this concern about keeping our residents and making it possible for folks to stay in their homes, some of them in these homes for decades or even for generations. So I too look forward to seeing a full-throated rollout and a program that is adequately funded so that more people can be helped, so many people can be helped in a way that makes sense, that is looking at the concerns so many of us have about equity, and which will allow people to continue to be proud and comfortable and safe residents of our city. Thank you.
Thank you. I'm going to call on Ms. Wilms, if you would, please.
Thank you. Again, we just received final guidance in last month on how this money could actually be spent. We chose our priority as a violence prevention program. Again, we're building these programs from zero. So the fact that we're spending our time, we're trying to be wise with the dollars and make the priorities, but I can guarantee Tamika is keeping us on task with this one in particular. It is her next priority. She has tasked all of us with this particular home rehab program, again, growing the program from zero, what we can do, what we might need to contract out because we cannot do, and making sure that we can get these dollars out as quick as possible. That's everybody's goal. So we will definitely keep this body apprised as those positions roll out, as the application gets finalized, and some of those opportunities do come up in the near future. But thank you.
Thank you. Mr. Neal.
Thank you, Mr. Chairman. My concerns align with my colleagues in regards to this unique opportunity we have with ARPA dollars and the lack of conversation amongst us on council of understanding what our goals and objectives were for our wards and how we can create capacity and sustainable infrastructure at this point in time. I know we all turn to plans, but we have yet to have a conversation. And with us having representative government, compound that with the meetings we had in our wards, I would think each one of us has a good idea how these dollars have to be invested. My concern truly is the capacity for us to do whatever we say we want to do, as well as we should be putting something in place to making sure that as we invest these dollars, whatever we do will be sustainable. I say capacity because to Councilwoman Amobian's point about eviction, there is money still available to help people with the eviction. They get up to like, I think 15 months rent paid. But some of the applications are 6 months behind being processed. There's a capacity issue. There is money coming to help people with their mortgages even. So I think for us to be able to leverage our position to bring those who are doing the work to see how we can help increase their capacity and make this investment better. But this cannot be done on a grand scale. I believe we have to bring this down to a ward level and create the infrastructure within our wards to be able to address this. Those wards that have CDCs work with those that don't work with other agencies. But that doesn't take place unless we as council have a conversation and we make an investment in our ward. We're investing in organizations, but we have not invested equitably in our wards. And if we were just even to take the term equally and take, I remember at one time, Councilwoman Mosley stated if we, before we start looking at equity, if we just looked at equal, and where we could, just took 10%. That's $1.4 million in each one of the wards. But we have to have that conversation, and I'm concerned because we still haven't had it, and we don't have, as council, we don't have a metric to be able to tell if these dollars that we're investing are equitable, and then more importantly, making sure that the ARPA dollars are invested in the way that they came to our ward. So I'm hoping that before we're asked to pass this, we can have that conversation. And last but not least, we asked Mr. Fricker if he could give us, in the past, we used to get a breakdown of all the different positions within the departments, not just one lump sum saying salary, because we know, and rightfully so, in a budget year, you may have a position budgeted, and you may not have anybody there. But for us to get to understand our ability to perform with what we have and what we need to do to build capacity, we need to be able to see those breakouts. So those are my questions and comments for right now.
Yeah, so let me speak really quickly to the documents and the questions that were asked last week. Our audit Staff has been compiling all that information along with the position listing. We do anticipate distributing that this afternoon.
Okay, would that come from you or Ms. Donnell? Who would that
I
be
think it's going to be from Mr. Wheeler, Ms. Donnell.
Okay.
I do have one file I'll send myself. That's the position file, but we should be distributing that this afternoon.
Okay, so everybody that's listening is online, we can watch for that. Very good. Other questions or comments? I'm looking on the screen or looking in the chambers. Mr. Malik.
Thank you, Mr. Chair. First, I want to thank everyone who helped put this budget together. It's clear from our hearings last week that an awful lot of work went into this, and there are a lot of important priorities in the budget. After our discussion, per the conversation that we had on Thursday, I did send an email to City Administration and Council leadership about some changes to consider. I just wanted to restate those here. Particularly, really strongly urge Council to consider allocating funding for the hiring of a cabinet member who can focus on racial equity and the implementation of the Racial Equity and Social Justice Task Force report and recommendations. I think it's really critical that we have a person who is full-time dedicated to that work, who doesn't have to split their time between that work and other projects. Often when we spend a long time putting together reports like this, and often the difficulty is in implementation because we have staff who are spread across many different priorities. And that's why this role was, hiring someone for this role in 2022 was a top recommendation of 2 different committees of residents that we empowered to give us ideas of how we can make a more equitable community. And so I really think, I understand that we don't necessarily have the details ironed out and that the report came out recently, but I really strongly believe that there is not any harm in allocating funding for that position. And if we do not do that, we're sending a signal that we don't necessarily agree with the need for that role. And, you know, I think that we really need to capitalize on the sense of urgency regarding this. The second thing would be another recommendation from the task force, which we heard from our police department that they don't necessarily have the number of body cams to allow officers who are doing extra work jobs or who are on the SWAT team to use body cams, right? And again, that was a recommendation from the Racial Equity and Social Justice Task Force to implement in 2022. If we could allocate funding for not only the hardware, the cameras, but also the software storage to allow for that to be implemented, I think it'd be a great service to our police department. We all know that body cameras help promote accountability and trust between police and our community. SWAT team members are often tasked with using lethal force or the threat of lethal force. Those incidents are often have the possibility of resulting in death, and there's a need to use body cameras there. The same thing with extra jobs, right? Our officers should be using extra jobs there, but they can't do that if we don't empower them with the actual resources to do so. So I would encourage us to make both of those adjustments, and I hope that's something we consider over the next week.
Thank you, Mr. Malik. Mr. Fusco?
Yes, thank you, Mr. Freeman. I just want to make sure I understood something correctly. I have a question for Mr. Neal, and I just want to make sure I understand this and that we all understand this, that there's money out there for mortgage payments, and there's money that this, if I understood this correctly, that the city is involved with money for rental assistance. I want to make sure, is that, and they're 6 months behind? What, I want to make sure I understand that.
Was that a question presented to me, Mr. Fusco?
Yes, Mr. Neal, you had mentioned that there's money for mortgage payments and that there's money for rental assistance and that there's 6 months, we're 6 months behind on that. So I wasn't clear. I just want to make sure.
Yes, sir.
Thank you.
Yes, sir. Right now there is money for rental assistance, and they are 6 months behind on processing some applications because some people have tapped into the funds one time. Others are on their second round. Those who are on their second round, those applications are being processed don't have a higher priority, but the reality of it is they're still behind. Those applications, some of them are 6 months behind. I think you could talk to some of the organizations that are processing those, like United Way, Community Action, Mustard Seed, others. They're 6 months behind. And in coming down the pipe is money to help people with their mortgages. So it's critical that we have an understanding of these services that are out there and that we utilize whatever resources we have and influence we have to create sustainable wraparound. We talk about wraparound for our students. We need wraparound for our communities to make sure that people aren't dropping through the safety nets that we have there. And there's a disconnect with people being able to get information. You know, very few people get the Beacon Journal. So how do they get their information? And I'm saying if we can have a better understanding of what the capacity is of the organizations that are out there doing the work, what their challenges are, and getting connected to people, we can help this. Because to Mr. Mobian's point, a lot of evictions could be prevented if people could be connected to the services that are there right now.
Agreed. And like I said, if there's a gap out there, I'm just curious, are these city ARPA funds or are they county funds? It seems as though...
The rental assistance dollars came from the county, came down through the county, I do believe.
Okay, thank you. Yeah, that's what I just want to make sure it's clear for everyone here that, you know, it's city or county, that's a county side. But the thing of it is, and that's good information for us to make sure that we do have capacity whenever we do go out, and we make sure that the funds get there to those that are most need in a timely fashion. And, you know, I would almost say that, you know, being cautious and trying to move intentionally in terms of making sure this is done right is better than just moving forward and just pushing out funds, making sure that we do it right. And I think we all want to see that at the end of the day, that we don't want to see, you know, delays out there. So, and understanding as well in terms of the ARPA funds that, you know, it's been finalized just recently, you know, now is our time. And I think we all had an opportunity and more opportunity, especially through the ward meetings. We had the 10 ward meetings. We had a number of hearings within these chambers in reference to this, you know, to provide what our wish list is, if you will, what we would like to see. And I believe that there's going to be more opportunity for that. And so I said it's you know, let's, now that we do know what those final requirements from the federal government is going to be, now is the time for us to go in and say, hey, you know, we want to make sure we do this right. And so that's what we're here for. Thank you.
Yeah, and Russ, or Mr. Neal, about how many, this is just for my own, about how many agencies was the county working with? Do you know?
That, sir, I do not know, but I can get that information by this evening's meeting for you.
Okay, that'd be great. Thank you. All right, I want to come to Ms. Amobian.
Thank you, Mr. Chair. You know, I don't want, and I don't think anybody wants any sloppy, thrown together program. But we have to stop saying that we have to wait to get it right. We need to have a program to roll out. We have been involved with this for months, and we have added all these little pet projects to the budget. We had no problem adding them, all these new housing, all of this. You know, I love everything that LeBron James has done for the city of Akron and everything he represents, including his basketball skills. I still don't understand why we have the Housing 330 project there with all of those merchants going into that building that are going to pay rent to that facility. That's $600,000, whatever the amount is. I don't have it right in front of me. But how many houses could we renovate over the spring and summer with those dollars? We could put that program later on if we want to do anything, or if we have funds to do anything. I am deeply troubled by the fact that after all of these months, we cannot roll out something for the people to start rehabbing their houses this spring and this summer. And we keep talking about waiting to get it right. I mean, do we need some more heads or voices in the room? Part of the concern that I've always had, and Mr. Neal touched on it, is that we've not been privy to these conversations, but yet when we start asking questions, all of a sudden people want our input. You know, there are communities all over this nation that I heard about when I was in DC last week who are doing all kinds of rehab programs, eviction programs, and if we don't have a roadmap ourselves, there are all kinds of folks out there. NLC could direct any of our staff to help us design something. So I have a problem with us always saying that we have to wait to get it right. I don't know, because I don't know what right means, you know, in this scenario. When the dollars are almost spent, is that what it means? Thank you.
Ms. Wilms.
No problem. We are very early on in all of the ARPA dollars. Very little of that money has been spent. A lot of it has been tagged for programs and plans, but again, we're at the infancy of all of this. I can definitely share your frustration with those that I work with, those that I lead, to make sure we're staying timely, we're staying transparent. Any questions that you have, please don't hesitate. Ms. Zamobian, I will have somebody reach out to you about that 330 program. I think what that money is intended for might not be articulated well, and at this point I can't articulate it well, so I will get that information for this group. Back to the task force recommendations. I cannot thank the task force enough, the people that were involved in this group, for those recommendations. Mayor Horgan knows racism is absolutely a public health crisis. We're going to do everything we can to address that public health crisis. I cannot listen that we don't care, we're not doing anything. We have a report. We want to take our time, figure out where those resources are and how we can best use our resources to address this issue. We have used our resources to address this issue. The work that Tamika's done over the years, the work that Myra Snipes done over the years, the work that Yamini does in HR every day for us, the work Marco does every day for us. Can we put that under one leadership tag? Potentially. And it is an honest conversation that we've had ongoing since we've seen this report 3 weeks ago. So again, just asking for a little grace, a little time. Internal conversations are taking place. What resources we have, what's the best use of those resources, but have no doubt it is a public health crisis that we will stand before you and address.
Thank you. Mr. Neal.
Thank you, Mr. Chair. I would just like to stress, again, we're in the midst of budget hearings. We have these ARPA dollars. I would like to see us make investments in the wards so that wards know that they have what to work with, just like we did with the COVID dollars. That's an easy way to be able to measure the impact. And more importantly, we're getting ready to set our budget. We have not had a conversation with our colleagues on the school board on how we can make sure that we create synergy between our work. And let's not fool ourselves. We all know how challenged our schools have been this year with disturbances because of COVID and just society as a whole. This is spring. We know what happens every spring. And to say that our plan is just investing in youth organizations is not enough. It's unfair even to put that burden on them. We need to create a definite plan within our wards, because when the stuff jumps off, they're not going to call Boys and Girls Club. They're not going to call Boy Scouts or whatever organization. Each one of us is going to get the call. We need the resources, and we need to have a plan on how to address this. And we need to be working, while we have time, working with our schools. These dollars came into our wards. We have an opportunity to do not just a program, but to create groundwork for something that's going to be sustainable after this. Creating wraparound support for just like we talk about for our schools, for our communities. So I'm hoping We could call emergency meeting, whatever we have to do, before we're asked to pass this budget, that we have made dedicated allocations to our wards, so that we have resources by which to work with our constituents that we had meetings with when Guidehouse came to our communities, so that we can address the needs specifically to our wards. I can't speak to Kenmore area, Mr. Freeman, but I can definitely speak to West Akron and what Ward 4 needs, and nobody knows better than me and the organizations that have been working, providing that support over the past few months, anticipating these dollars coming in. Thank you.
Thank you. Mr. Fusco.
I don't want to prolong this any further because hoping and assuming that the committee's going to take time on this, which will give us more time to look at this and prepare any amendments, what have you. But, you know, the thing of it is that before Shelley left, and even, excuse me, not long ago, maybe 2 months ago, you know, all the volumes of information they had to go through, that the administration had to go through to make sure that, because this is unprecedented in terms of this kind of money being available, and the feds put a lot of thought into making sure it's done right. And from what I have heard and from what I understand, that there has been some cities out there who have rushed and who've been called on the carpet from the federal government in terms of rushing through to this. Last year, you know, there was a lot of talk about, you know, us maybe taking our time to make sure we gather all the input. That has been done, and it's even going to be done because I assume soon we're going to be able to see the interactive app that's going to be available out there in the community to get even more information. But the thing of it is again, like I said, it's, you know, to get this right, I think is important, and I think there is some cities out there who hasn't gotten it right, and they've stepped in some problems with the federal government. And now we're, it's just, like I said, this is a lot of money. We don't want to get audited. I don't think so. And we want to get this right. We really do. And so, so let's do that. Thanks.
Thank you. I'll come to you, Mr. Malik.
Thank you. Mr. Fricker, the ARPA dashboard that Mr. Fusco mentioned, do you know when that will be available?
It is being worked on as we speak. I know we've actually seen kind of you know, a preliminary copy of it. I believe it's very close to being, you know, available to the public, but I don't know the specific date, but we do have a kind of a working version of the website that has been built.
Okay, are we talking about weeks, months? What are we?
I would say, I believe weeks. I'll put it like that.
Thank you.
I believe weeks too.
Thank you.
Yeah, and we all anxiously await that.
Yeah, this looks good.
All right. Let's see. Do I have? Okay, Mr. Neal.
Thank you, Mr. Chairman. I just want to state, to ease concerns, you know, we are a member of NLC. We can tap those resources. Mr. Mike Wallace, who is the federal advocacy contact for municipal leagues with the U.S. Treasury, would be welcomed to come and ease any concerns that we have. Mr. Fusco mentioned other cities. We can tap into our colleagues right up north in Cleveland, or to the west of us in Youngstown, or to the south of us in Columbus. But Mr. Wallace, who's the one who negotiates on behalf of all municipalities with the U.S. Treasury on behalf of NLC, is someone that we could easily have come to our meetings so that we don't miss this opportunity, as you said, to do it right, but to also equip all of our communities with the resources that they need to address the specific needs in their ward.
Thank you very much. All right. I believe we had another item. Mr. Malik, you'd like to address this, please?
Thank you very much. I believe we have our Health Commissioner, Donna Skota, here with us. I know that, obviously our health department is, has been merged with the county for a long time now, but particularly with COVID, thought that it might be helpful, since we're going through budget hearings, to hear, just as every department came in last week and spoke with us about their goals and objectives and their budget for the coming year. Commissioner Skota, just wanted to, provide you with an opportunity, if you were interested in addressing us, as to, obviously, we know we've worked with you over the last year, but some of what you're hoping to accomplish over the coming year, and also what the fiscal picture looks like for the health department.
Okay, can you hear me? Can everyone hear me?
Yes, coming through loud and clear.
Okay, great. Okay, thank you. I appreciate the opportunity. Yeah, I'm going to just talk generally about where we've been, and sort of kind of give you the highlight and how your budget process fits into ours. Basically, as you know, we're a separate taxing district, and when we did merge, we became this combined general health district, which is 3709, 3707 in the revised code, meaning we're required to follow such rules and that are dictated in there. I think everyone knows that. So we are legal to operate as a health district, and it also, we just had our district advisory council meeting on March 7th, which again, they all vote to reinstate us again, and we continue to approve all of our contracts and all of the doings of the health district. Our total budget for the health district is about $24 million, but that's made up of about half of that comes from grants. We've always been a department that has relied heavily on grants, and we have been able to be successful at writing grants, and a lot of health districts, even city health departments, don't really like that as much. Because it can be cumbersome and work, but it really has helped us be successful in providing services without raising our cost. If you remember, and many of you may, when we originally merged, we decided to keep 3 years of actual cost. So for 11, 12, and 13, we literally ran 2 sets of books. And were able to provide actual cost. Therefore, in, I believe it was March or April of 2014, we put in place for health services a contract that it was for $4,038,344. And I'm happy to report that we have never raised that, and our intention isn't. Now, our employees get raises, but we've been able to be very efficient as one unit, and we have been able to maximize grant dollars to offset general revenue dollars, which allows us to keep our costs to our cities, villages, and townships stable. Because I'm sure many of you also remember that it's been tough for cities. That's why I so appreciate the conversation earlier and the collegial sharing, because quite honestly, cities have never really had many opportunities like this to make some really vast improvements. And it is important that the planning be thoughtful and get it right, because it has been difficult. So as you know, we're coming out of a couple years of COVID, as is the world, at least trying to. We're hopeful that we have enough vaccine out there and that enough folks have had COVID, that we may have a milder surge than we had last year. Certainly, we do expect some uptick in the fall. I mean, it's a coronavirus. It's going to circulate like other coronaviruses circulate. And so what we're hopeful is that we'll be able then to respond, but we're responding a little differently in that the state has suspended some of the rules for investigation. We will still do contact tracing. We will still try to make sure to mitigate disease spread, but we do think the response will be different. So for right now, we're trying to normalize operations as much as we can. We had a heck of a surge in November, December, January, and into February, and then it's been very interesting, the numbers, the cases, and as you know, as quickly as Omicron has come, it has left, which is a nice thing. It's done that around the world, Its sister BA2 is circulating. Currently, we have had no cases in Summit County of BA2. It has been predicted around the United States through genomic testing that it's about 8.3% of the cases right now. The dominant strain is still Omicron BA1. So hopefully, and it only appears as though the only real difference is it may be a little bit more contagious, which is not that unusual for a virus, but also that we do think the vaccines give protection just like Omicron. And as this evolves, we will constantly respond as best we can to all of the needs of the community, certainly, but the disease as it rolls out. Now, in regards to goals for the future, trying to what we're looking at areas where we think there's a huge need, and I appreciate the comments around housing and repairs, because we do run the HUD-led program. We have a lead program much like the city, and there are a lot of homes that are in need of some repair. We also are looking at all of our harm reduction programs to make sure we can keep folks alive so that they are able to seek treatment for either drug, alcohol, mental health issues, whatever. We also have all of the STD, sexually transmitted infections. So we do provide services, and we're looking at expanding that to some additional reproductive health. We received some grant money that allows us to be able to provide some family planning along with those STIs. And we're also allowed now, we're doing some senior home visiting. And many of you who may have been at the District Advisory Council, we run a program called Gatekeepers. So if you have a community member you're concerned about, you can call our staff, we can do a home visit, we can do some ongoing case management to try to make sure that person is safe. And so I'll stop there because I'll talk way too long. But I'm glad to answer any questions you might have or address anything that I missed.
Thank you, Ms. Skoda. Anything?
Mr. Chair?
Yes, ma'am.
I certainly want to thank Councilman Malik for suggesting that we reach out to Commissioner Skoda, because I hadn't thought about it, because I had just assumed that her budget was pretty stable in serving the entire county. But this is always good information to have. And I know that your staff from I think your alcohol and drug program, or one of your programs over there, they go out with our officers to do a quick response team. And they were part of our discussion as we were talking about reimagining policing in the city of Akron. But no, we thank you for the work that you do and your staff, and we have nothing but a lot of pride in our health department and all that you've done for us, particularly during this pandemic. I'm curious as to, I know we recently, as council, purchased, the test kits and all that kind of stuff, which is quite expensive and hard to get. Do you have extra test kits and all those kinds of things available to the public still?
We have some. It depends on what they're after. Excuse me. The state provides those to us. So the state has requested that we save all of our proctored tests for school districts or for individuals that are in need, like a school district. We do some testing here at the health district. In the morning, we test kids 8 to 9, usually we test for flu, influenza, RSV. We'll do some testing for children. And then we have for the general public, we have some of the at-home tests that we have been able to hand out. Now, we've given some of those, most of them have been given to first responders, and then also we have given some to churches in the community. We've had 2 drive-thrus for churches to pick up so that they could distribute if they needed for their parishioners. And then we're also doing another safety force giveaway, and then we're going to look at fast food restaurants to give test kits for all of our restaurants to have as well, so that they would be distributed. So like, let's say if you have a worker, you're not sure if they're sick, you'll be able to have the test kit. We don't know how many more the state is going to purchase or for how long we'll have them. The libraries have some. Our worry is we did buy, or we didn't buy, we were given some that we've held on to. We have a case for the fall, but it has a longer expiration date on it, and we're afraid that it could be short supply again. So we do have a few the state has promised us, and we have for the fall that we're keeping right now. They don't expire until January. But as you know, every time they expire, then they extend it a little bit. So the problem is if that test expired, you can't use it proctored. So we're actually telling folks those tests are still good, but you just can use them at home, but you can't really do anything with that result except know whether you're positive or not. Yeah, so Linda, we still make every effort we can to get as many tests as we can to put out into the community.
Thank you so much for coming on such short notice.
Oh, you're welcome. I appreciate the invite.
Come to Ms. Holland, please.
Thank you, Mr. Chair. Welcome, Commissioner Skota. I used to see you from time to time over at Children's Services Board meetings. It's nice to have you here.
Hi, nice, thank you.
You're welcome. I think my question is in the order of a follow-on to Councilwoman Amobian's question, and it's in the area of vaccines. And I'm an avid news reader. I read several newspapers a day, and I've been following with some interest the BA2 reports and the current surge that's happening in Europe. Guardian, BBC, and New York Times all observing that as Europe goes, typically the US goes in usually something like 4 to 6 weeks.
Correct.
Meanwhile, it's my impression, and I have not done a lot of detailed reading about this, but it's my understanding that Congress is currently hesitant to pass more funding that would go to vaccines and for treatments for COVID infection. And we are, and I guess I'm running this by you in question form, we are potentially facing a universe where vaccines might not be free and treatments might not be free. And so I guess I'd like your comment on that and whether you think that that's near term and whether you think we should all be hustling in to get our 4th shot.
Right, okay, I'll take it kind of in parts, okay? The first part is there's been a lot of CDC released information around like these pockets that are sort of popping up all over Europe, and in China is a big one. And what they're finding is those are populations that have not been exposed to Omicron. And so you're starting to see Omicron BA1 rip through those. So they're hoping they'll go quickly and leave. However, every time somebody gets sick with one of these viruses, whether it's Omicron B, whether it's Alpha, Delta, it has the risk to mutate. And that's what we worry about, are those mutations. That's why they're monitored so closely. Because right now we know we have BA1, we know have BA2, but it's hitting populations, particularly in China, that's sort of self-regulated and self-isolated and have not yet been exposed to Omicron. So CDC has kept a watchful eye on that to say, is it really going to hit here in 4 to 6 weeks, or will it hit populations that we do know have not had that exposure? In this country, we've had wide exposure to Omicron. Plus, we have some fairly high, significant vaccine rates. Again, some of these countries have none. I mean, so you're going to see it pop up. Again, the problem with not vaccinating worldwide is that you always have the opportunity for a mutation. And that's where the scary part comes in. So we could be sitting, the federal money, the appropriations bill you talked about, the $6 billion was taken out for testing, free treatments, and some of the vaccine delivery. Well, a lot of folks were already charging the administration fee, excuse me, and the vaccine was free, but people were still charging some insurances. We chose to charge no one for anything simply because we felt it was a barrier. When you start collecting people's insurance information, it's much more difficult to rationalize with them a vaccine. And so We didn't do that because the state gave us dollars to help offset the cost. So we were able to balance that and budget accordingly. The issue with those dollars, they have now been introduced in a supplemental bill, double that amount of money to make sure that testing is available, to make sure the supplies are available, and to make sure that any treatments are available. So hopefully, according to the federal government, they're talking about a program where if you can show a positive test, you'll be able to go to a pharmacy and receive the antivirals. Right now, the antivirals are in short supply. Ohio has some, we don't have tons here yet because it's being manufactured and distributed, but I do see that you'll pick up. But right now you have to go through a medical provider to get either the antivirals and or monoclonal antibodies or convalescent serum. So there's gonna have to be some sort of either a step away from that medical model and you can just pick it up at a pharmacy. But I can tell you that will only come with additional funding. So it's imperative that they pass that bill and have those extra dollars come. And we'll have to see. If not, it'll fall back to insurance again, insurance companies, and then you'll have folks who aren't insured, and there's going to be barriers that are set up for people that will not get that care and won't seek that care. And then your last question, I'm sorry, was?
I'm so
there
sorry.
Was one more. No, there was one part.
Well, I think it was related to this, which is what happens in the event the federal funds don't come through, in the event we go to an insurance pay model. Here in Ohio, of course, we are comparatively better off than some states that have not passed Medicaid expansion.
Right.
But do you envision a scenario where Summit County Public Health has to step in and fill the gap for those who are uninsured and or not enrolled in Medicaid or who fall into the gap population that you and I have discussed in other places, other meetings?
Yeah, it could very well be. We would be the provider for all the uninsured, plus the F2HCs, the free clinics, those kinds of places too that are used to the uninsured. And we may have to purchase the vaccine. It could become part of the Vaccine for Children program free. So there's some ways the state could work it. We'll just have to see how it comes down and where it comes down. But it could be our responsibility. And we would gladly take that on because we want to make sure everyone has access.
And I remembered my last question, which was, should everybody who has been vaccinated and boosted be looking at another shot if they are more than 4 months out from their third shot?
Yeah, currently no. Currently right now the recommendation is that it's, there's not a one that's being recommended. There's been some, Pfizer put some data forth and so did Moderna. To my knowledge, neither of those have been approved yet. However, there's been clinical trials that have said right now 6 months past your booster, you still have an immunity. So I'm thinking it's going to be more somewhere down in the fall. Moderna is also working on a combination vaccine, flu, COVID. So we'll have to see whether it ends up being that we need a fourth. Now, right now, they're recommending a fourth shot for individuals who are immune compromised, have had some significant issues like solid organ transplants, special diseases. They were eligible for 3 vaccines in the primary series and a booster. So they were actually eligible for 4 right now. And so Moderna and Pfizer are both going to push for that 4th booster. But I think they were holding back a little to see if they had to tweak it for Omicron, BA1 or BA2, because it may need to be tweaked to boost the immunity.
Gotcha. Thank you so much, Commissioner.
Oh, you're welcome.
Nice to see you.
Nice to see you. Thank you.
Mr. Neal.
Thank you, Mr. Chair. Good to see you, Ms. Scola. You mentioned something that piqued my interest when you said gatekeepers.
Yes.
And that's a group that goes out to check on seniors, it sounded like?
Well, yeah, what it is any number of individuals. We have training we can do for organizations. What we do is it can be police, fire, it can be a citizen, you can do it anonymously. You call up saying, Mrs. Jones appears to not be picking up her mail. Excuse me. She doesn't seem to be, like, she hasn't walked her dog in 3 weeks. I'm a little nervous, you know, I can't get, you know, so we could do a home visit. We would make contact with her and then provide case management services, excuse me, if necessary. And we would try to make sure that Mrs. Jones was safe.
Okay.
And so, I'm sorry?
No, I just want to say, I'd like to learn more about that.
Yeah.
I see Mr. Lash is on the line. We've talked about creating neighborhood ambassadors, and this is creating that community wraparound that we talk about. We really think about it when, like when we had the snowstorms and, you know, street plows come down, the seniors can't get out and plow their, shovel the apron on their driveway. Just ways that we could provide that wraparound support. I want to learn more about that, but I want to ask you from the standpoint of agencies that deal with opioids in my community said that there's been a spike in opioid use.
Yes.
And there's been even a concern with seniors over-medicated because of this. So I'm wondering, do you have any preventative, like, information that we can get out now that it's spring and we're able to get out a little bit more? Because I'd really like to, like I said, learn more about that gatekeeper so that some of these people that want to be community ambassadors, we can kind of, like, if possible, participate in your training so that we can help expand your reach as well.
Yeah, that would be wonderful. We've done trainings for, like, at the District Advisory Council, we had every city, village, and township there. And so what we do is we usually talk about programs, and that's why on here, like I mentioned, things like we have gatekeepers now. We have the dollars to be able to try to do some more senior interventions. You know, most seniors want to stay in their home, which is fine, but you have to be able to do that safely. So sometimes we have to put some services in place or talk to family members or anything. But we can certainly get them trained, and then we can get you information about some resources for prevention around substance use disorders, because it isn't just opiates. I mean, it can be other things too. Alcohol is still the #1 drug that's abused. And so, I mean, we can talk about that, and we can get that information to your ambassadors. And Russ, I'm going to have, excuse me, her name is Donna Barrett. I'm going to have her give you a call and get her to set something up and some sort of a training or whatever you want to work, because that's what they do. And then they try to get community agencies to want to refer if they find any of these issues. You know, it's sort of a middle step. I mean, obviously you want somebody safe, but sometimes situations are bad where Adult Protective Services has to be called or some of that. But typically this is that gatekeeper trying to help them be successful in what they're doing at home.
Thank you. Thank you.
Oh, you're welcome, Russ.
Thank you, Ms. Skoda. Thank you for the conversation. Anything else? All right. Any other further comments? We will continue to take time on our old items. And if there's nothing else, we are adjourned. Thank you again, Ms. Skoda, for coming in. Thank you.
Oh, you're welcome. Thank you for having me.
Final committee meeting of the day. Council will meet at 7 p.m. tonight. Thank you.